it's Shay. Welcome back to the channel where we talk about beauty, nursing, and lifestyle. It has been a while since you guys got a video from me. Here on my channel, I took you guys through my registered nurse journey. I took you through my FNP student journey. And here I am sitting before you guys today as a practicing nurse practitioner. So a lot of you guys know my recent videos kind of surrounded about me passing my boards and me getting credentialed. But have I talked about what I've been doing yet? Guys, my life has changed drastically, and that is the purpose of this video. Today is a Q&A. I'm about a year post-grad, almost a year post-boards, and about 5 to 6 months as a practicing nurse practitioner. So I want to give you guys the tea on what's been going on as we get this channel rocking again. I went on Instagram. If you guys don't follow me, here's my name. And I asked you guys, what do you want to know? Work-life balance questions, and y'all came through. Let me show y'all how y'all came through. Y'all came through with the Q&A questions. So I got a lot about work we're going to discuss. I have a little teeny bit of beauty, a little teeny bit of lifestyle, but we're going to go ahead and crunch some questions and get into it. If you don't have a snack, grab it. If you need a water, grab it, because this is going to be a long video, but I promise y'all, you will get all the info you need here today as far as updates, and we're going to keep it trucking. Make sure you like, make sure you subscribe, and let's go ahead and get started. Okay, guys, so I think the perfect question to start off this Q&A is, what specialty are you working in, and how are you adjusting to the 9 to 5? So, I will tell you guys right off the bat, as soon as I graduated, I did start applying to jobs. Most of you, if you followed me through my FNP student journey, you guys knew I had a thing for primary care. So obviously I looked for primary care jobs. I also looked for, you know, what specialties had to offer, but I thought I was really going to take the typical route like I did as a registered nurse. Start with the foundation, so that was med-surg as a nurse. I was considering primary care as an FNP, and then work towards my specialty like I did as a registered nurse when I started cardiovascular care. And I was going to work towards either endocrine or cardio because those are the top two specialties I have the most interest in. Long story short, guys, there was a cardio position while I was applying. I went ahead and applied for it, didn't think I would get it, knew I was a new grad, just said it is what it is, and your girl got an offer. So your girl is officially a cards NP. It is crazy to me. It is hard. It can be stressful at times, but it is what I feel like. I just took that leap of faith. I knew it was something I wanted to do down the line, and I said, hey, why not do it now? I'm young, I'm ready to learn, I'm fresh out of school, so it's a good opportunity to get a lot of learning in. But it is challenging working as a NP in a specialty, so I will say that. Now, next thing, adjusting to 9 to 5 has not been a problem for me, guys, because I'm currently working 410s. I'm crossing my fingers and hoping it will stay that way because it was an easy transition to go from my 312s to 410s versus doing a Monday through Friday. I was not looking forward to that as an NP, but by the grace of God, this job currently requires 410s. Will it change? I pray it don't, but that's what I'm doing right now. Okay, so the next question here was pretty interesting and goes with the last question. Why did you choose cardiology? So I guess this person already knew. Or did the cardio life choose you? So I feel like it was kind of a mix of both. I kind of explained to you guys before how I kind of had a nick for cardio. Knew it was something I wanted to do down the line. Didn't know it was going to be something I did this soon. I feel like my path already landed me there. You guys know I started as a med-surg nurse with a hint of cardio because I was telly. And then I moved to a cardiovascular care unit while I was in FNP school as I was finishing up, and learned a lot there too, which also helped me be as good or as strong as I am in this position. I still have a lot to learn. I'm still a baby new grad. I tell this to people every day, but I feel like my path kind of aligned for me to be in this position, if it makes any sense. So that's how I feel about that one. Now, next question here is, talk about your client population and the type of conditions you manage. So I feel like telling you guys that I do cardio kind of covers it, but for anyone that doesn't know cardiovascular disease, it's like an umbrella. You put cardio at the top, and there's several things that fall off of cardio. There's electrophysiology, which is the conduction of the heart. There is heart failure, which is kind of like the plumbing of the heart. You have your typical coronary artery disease, or like blockages, plaques, things like that that cause heart attacks, MIs, things like that. There's so much. You have surgical cardiology, you have interventional cardiology. Me in general, I'm working in a clinical cardiology field, so I focus a lot on prevention, and it's basically like primary, secondary, and tertiary prevention. So preventing people from having events, treating them before they have something serious, and if they do have something serious, treating them afterwards to prevent them from having something serious again. So typical stuff: high blood pressure, obviously, high cholesterol, obviously, because those are the two prevention components. Coronary artery disease, like I said, so blockages, people that have to get stenting or have heart attacks, people who have heart failure, people who have like atrial fibrillation or any kind of arrhythmias and things like that. So I get a lot of practice in those areas, but there's also sometimes these very astronomical things that I've never seen before that I really need to consult with my cardiologist to kind of explain to me. So every day is different, y'all, in my job. I think there's another question that kind of asks me how my typical day goes, and I can tell you guys as of right now, there's a motorcycle outside, so let's hold on for a moment. Okay, so as my typical day goes, so I am currently, as I'm still in my new grad phase, I'm currently phasing in the hospital, which I know might sound a little bit different for somebody who is FNP. Again, something we will discuss on my channel in length soon. But my typical day is I get a load, or I get a list of patients. I can see anything from a consult, which is a brand new patient in the hospital for a specific cardiac reason. I can see somebody who's a follow-up, so somebody we have been continuously treating in the hospital for a certain condition until we can get them stable enough for discharge. And I do discharge patients occasionally because I work at a cardiac center where sometimes those patients are solely there for cardiac stuff, and that's what we're treating them for, and then we're actually the people discharging. So that's kind of the mix I get. I prioritize my patients based on not only diagnosis, but also based on, like, obviously I want to see a consult or a discharge before I see a follow-up, because those are patients I don't know. I might have to order testing for, I might have to check something before they're discharged and things like that. So that's kind of what I see throughout the day. As far as my patient load, I know that's a big question for a lot of people too. I've gotten up to 14 to 15 patients a day, which might not seem a lot, but when it's acute cardiology, it can be a lot. My typical is usually 10. I've gotten up to that max of 14 or 15, and depending on what the day is, it can fluctuate every single day. So that's currently where I stand right now. This video would have been so much more interesting if I was like doing my makeup or getting ready or chit-chatting with you guys, but you know, me trying to multitask, do makeup, do my hair, do anything like that and talk to y'all is going to end in a 20-30 minute video. So I'm really trying to keep this short and sweet, give you guys the points, but also give you enough so like you can continue watching and we can go into further detail, because obviously a lot of these questions are also going to spring some topics for conversation in separate videos. So anyhow, one of the next questions I got, I was cracking up when I read this, y'all, because I knew it was coming. So somebody said, please tell me about APN versus RN money. Are you really making that much more as an APN? And what do you plan to do with your pay increase? So the best way I can explain it, and I do this to my friends too, because I have this question come from a lot of people. This is an APN check and this is an RN check. Me working as both. Have I made the same as an RN as I currently do as an APN? Obviously, yes. When I look at the bi-weekly check, I have hit what my APN check is as an RN. Now, I will tell you that RN check included overtime, included bonuses, included incentives, including a lot more hours than just my typical 40 hours, work my 4 days a week and go home that I make here. So I know people will tell you all day, every day that RNs can make the same as APNs, and I totally agree with that. See nothing wrong with that. And I do think if you're making this decision, I can't talk. If you're making the decision to be an MP, it should not be based on money, because you're going to be upset. Y'all know I told y'all that millions of times on my channel, and I will continue to tell you guys that. Now, I am in a place where I'm comfortable. I was also comfortable as an RN. Do I think RNs can make more money? Of course, yes. But I am very comfortable now as an APN. Do I think I can make more money as an APN? Probably so, but I have no really major complaints, especially being a new grad. Now, as far as what I'm doing with the pay increase, guys, I'm really just trying to be very smart and financially like stable. So I'm taking the time to use this extra income to kind of gain more financial freedom. I'm paying off debts, which I probably will do a video about soon on my channel. I'm also obviously a person who took out loans for school, so I'm kind of working on that as well. And I really have a few goals that I want to see myself obtain within the next 5 years that really requires me to be a little bit more conscientious of the money that is coming in for me. So I'm able to provide for myself. I'm able to take care of myself. I do have a little extra money here and there to kind of, you know, enjoy the work-life balance. But overall, I will tell you guys, it's possible to make the same. It's probably, especially if you're like a travel nurse or something, you probably make more than me. That's fine. I know it was a controversy in a little TikTok video I did, but overall, I'm comfortable. I feel like anybody who wants to pursue a master's, an APN degree, just needs to be aware that it's not strictly about the money. It's honestly, you gotta make sure it's something you want to do because you're gonna work for it, but it's very rewarding work. We need a water break. So this next question is pretty good. It says, is being an NP everything you thought it would be? So I had this conversation with one of my colleagues kind of today who's also a new NP. And then we talked to a practicing NP who's been an NP for a while, kind of to try to see if they felt the same way. So a lot of this question is loaded because I'm only like 4 or 5 months in. 2, because I'm in a specific specialty. So I'm not going to see the same type of practicing versus me being in a primary care office, me being in a gastroenterologist office, anything like that, versus what I'm seeing in clinical cardiology, especially because the last couple months I've been inpatient. I haven't really had a lot of office experience as I would have liked. Now, I'm not complaining. I'm not saying that there's anything that, you know, this is crazy and I don't know why I went back to school. I'm very grateful for where I'm at and what I do, and I like it. But there are some things that I'm like, wow, I didn't realize this is how this would be. I have another question I think that kind of asks me, are there some things like that I like? What are some things I don't like, etc.? So I can kind of tie that into this question by saying some of the things I do enjoy about being an NP, which most of y'all probably already know, is the autonomy. I can make decisions about my patient's plan of care. I can act on those decisions. Currently in New Jersey, we are not full authority practice, so I do have to go through a collaborating MD. We do work hand in hand with an attending cardiologist, so I do have to go through someone before like the final decision is made. But if there's something I need to do for my patient, I do have a little bit more authority versus what I did as bedside to kind of make that happen. I kind of like also in this role that I can, as much as I can control it, work at my own pace. Now, I still need to be at a pace, being as though I'm acute care, that's going to make sure my patients are taken care of, but I'm not riding the tailcoat like I feel like I used to do a lot as a bedside nurse, but I do stay busy, I will say that. So in general, is it what everything I thought I would be? Not totally, but am I upset or mad or wishing that I could go back to bedside? Not at all. Never hated bedside, but I know this is more of what I see myself doing in the future. And then the next question is good. I feel like y'all kind of made these flow, and these are all from different people, but somebody said, do you miss bedside? And then what are some of the challenges you face as a new, young, black NP? Oh my gosh. So, as far as missing bedside, the only thing I can tell you guys that I miss about bedside, first of all, let me put this out in the universe. Bedside nursing now is very different than bedside nursing pre-COVID. Bedside nursing pre-COVID was crazy, but bedside nursing post-COVID is ridiculous. Like, and the nurses are great, the staff is great, the people who make the rules and the stuff that goes on, I don't know what happened, but it was a big change. So the thing I miss the most is being able to, now when I see my 10 to 15 patients, I spend 20 to 30 minutes with them at most at bedside, and maybe a few times if I have to come back for anything. I miss knowing my patients from the crown of their head to the sole of their feet because I spent 12 hours with them. Now, I might have complained because it was like 6 or 7 of them at one time, and I had to know 6 or 7 of them from the crown of their head to the sole of their feet. I knew them like anything. I do miss that a little bit as an NP, but you kind of get into that middle ground where you're spending more bedtime bedside time as some of your other providers, but you're not spending as much as you did as a registered nurse. So that's the only component that I kind of miss. Now, as far as being a new young Black NP and the challenges that I face, so some of these are pretty evident. I feel like the young is a big one because I have a lot of patients that are reluctant because I am a younger looking person, even though I'm about to be 30 soon. I get it all the time from my moms and pop-pops, like, are you even old enough to be here? And how you going to tell me what medicine you're going to prescribe? Like, who are you? There's a lot of kind of still controversial about what the exact role of the nurse practitioner is, and you will get a little pushback from not only patients but other providers. And as far as being Black, it is always going to be a challenge in healthcare in America to be a minority. Will people immediately say something to you in reference to that? Not unless they're like an 80-year-old grandpa with dementia, but you can kind of feel the animosity, and sometimes you can kind of get the vibes from people. I try to give people a clean slate. I try to approach every patient in the same way as if they were my own family member. I haven't had a lot of backlash as a nurse practitioner. I can tell you I had a lot more backlash as a nurse, and part of that is because I can get in a room and get out. Versus when I was a bedside nurse, oh, if that patient said something or did something to me, well, guess what? I got to put up with it for 9 more hours because I'm the nurse, and I just was the type that never just switched patients for no reason. I was getting toilets thrown at me and trying to get stabbed with a butter knife, and I still just wouldn't put that on my colleague because I'm like, all right, at this point, it is what it is. So, I mean, it's tough. It's a challenge. I try not to let it be the center of my challenge, but I can definitely feel the vibes when somebody is making it a point to be a problem, and I'll just say it like that. Guys, I'm trying to zip through these questions. I really want to make this video less than 20 minutes if I can, so I'm gonna switch over really quick just to a beauty question just to kind of switch it up, and then I'll bounce right back into some of the more nursing questions because I do have a few more to go. So somebody asked me, can you please talk about some of your recent favorite beauty products? Haven't heard beauty from you in a while, makeup, fragrances, etc. So as far as makeup, guys, I mean, you can see me on camera today. I have on no makeup. I don't really wear makeup a lot to work, but I am trying to, like, enhance a little bit. Versus, y'all know, as a bedside nurse, I literally rolled out of the bed 10 minutes before work and kept it pushing. Some of the beauty products I do like, as far as, like, if I'm going out or doing something, like, with my girls or date night or anything like that. So one of the things I really enjoy, and I think it's actually right behind me, yes, it's right behind me on the vanity, is the Rare Beauty blushes, guys. So I just like raved about these on Facebook. Haha, Facebook, who gets one there anymore? But these are so good. Like, I might never touch a powder blush again. Now, I have 20 million in my drawer, so I have to. But I like the shade Believe, and the shade Encourage I have in like a mini that I got from Sephora back here, and these are so pretty. Like, whoever did this, was it Selena Gomez? It was Selena Gomez, I think. She did her thing with these, and I'm definitely getting more. You need less is more. You only need one. The other day I wore this and I put on like 5 drops and my whole cheek was like pink, but it still looked good. Very pigmented, very good. Love them. As far as like lip products and stuff, because you guys know I'm a lip junkie, one of the most favorite things that I have been using recently is kind of the Juvia's Place lip glosses. So I think they're behind me as well. Funny how I can just reach back here. So these two are so nice, and the one I love the most, I don't think it's salted caramel. There's one that gives you like this gray sepia type look. I don't know where she's at, but it looks so good. So lip products, those. I've been really into like the brown lip with the lighter inner lip. Foundations, I've actually been struggling with foundations for a while. Can't tell you a favor. You guys know I stand Fenty for a while. Still in the tops, but I don't feel like my makeup is coming out like it used to. I don't know if my skin is aging or what it is, but that's a problem also. Okay, guys, and as far as fragrances, so some of my favorite fragrances right now, you guys know springtime is here. So I definitely been tapping into that Yara. I'm pretty sure it's like a fad now. Like, everybody knows about Yara. If you don't know about Yara, I will try to put it here. I should have grabbed it before I talked. So that is a fave. I've been getting a little bit more into Ariana Grande Cloud, which you guys already probably seen my Instagram video about that being like a dupe, in my opinion, to the Baccarat Rouge 540. I do have the real Baccarat Rouge 540 right now, and I will tell you guys, it's actually not as good as I thought it was going to be. I don't know if it's because I didn't get the X straight or what, but that's that. And then I've really been into like kind of floral scents, so I'm trying to like use my Miss Dior, and some other things like that. So right now I think the top favorite is just the Yara, and I do have some fragrances on the way. I shouldn't have ordered them because I said I wasn't gonna buy any until I emptied out, but I do have, I think, C Passion on the way and Billie Eilish, so I will keep you guys up to date on those. I'm pretty sure I'll be doing videos on those soon. While we're talking about that question, one of my friends did ask me what scents of cologne women like on men. So this is one of my guy friends. So I feel like one of the perfumes that I like, or not perfumes, colognes that I like on men, and I know this is maybe overrated, I heard some people don't like it, is it called Sauvage or it's not Savage, I think it's Sauvage. I think it's very sophisticated, and I think that's by Dior. So I think that smells really nice on men. I also do know, I think it's called Y by YSL. That's another, like, I can pick it up like that. I will tell you, men too, Baccarat Rouge 540 is unisex. So if I smell it on a guy, it's all about body chemistry, I feel like, with that one. But if I smell it on a guy, it smells good. It smells good on me too, but it does smell good on men as well. So those are some of the things that I kind of pick up on very easily. I'm not an oud girl. I don't like oud. I know oud smells good on men. To most people, I am not a fan of oud, but I do like those like sultry scents. So like Sauvage, I feel like that's very sultry and very sexy. I also feel the same way about Y by YSL, I think it's called. I'll try to see if I can put the bottle here. And I low-key like some of the Bath & Body Works stuff, even though that sounds a little corny. Y'all know I stand Bath & Body Works. Some of the men's stuff by Bath & Body Works is really good, especially this one scent called Black Tie. Sis, it smells good. So those are some of my favorites there. Alright, let's get back to some nursing. So, talked about my patient population. The last couple questions here. So somebody said, if you could tell your younger self anything, what would it be? So I think that's always a great reflective question. And just, if I was my younger self, the biggest thing, I feel like I posted this on Facebook recently, get that money. So I feel like the other thing I will also tell my younger self is to be wise with your money. As I'm approaching my 30s, I am quickly realizing, as good as I have been as a financial person, like I told y'all before, I'm able to, you know, afford to keep a roof over my head, a car, I get maintenance on my car, do things like that. I still have made mistakes in my past, in my 20s, when it came to money. A lot of mistakes. And I'm working on correcting those mistakes now. Credit's good. Everything like that is good. But needless to say, I can look in my room and tell you 15 million things that I should not have bought, that I bought because I was an impulsive girl in my 20s. So I think that would be the biggest thing, is just to be wise with your money, invest your money. High yield savings, like I should have been did that when I was like 21. Like, what am I doing? So it's just all lessons learned. But those are like kind of some of the things, just to hustle hard, get your money, take care of yourself, and put yourself first. I feel like those are the things that I wanted to tell my younger self. One of the other questions that's lying here is, what are some tips you would give to those aspiring to be NPs? So one thing I will tell you, if you are in NP school, looking to go to NP school, be a sponge. I feel like I tell people this all the time with everything, but NP school has so much to offer you. I was gonna say for free, but you pay for it. But there's so much learning to do. So much learning to do before you have to be the provider. Soak it in. When I was with my preceptor, I took in so much information, took so much notes. It's been great for me to go back and grab that information, but there's so much stuff that I kind of wish I would have took in a little bit more to just make me feel more comfortable as a new NP. Study hard. I feel like everybody will tell you that. Be mindful that you're in NP school while you're working. So I feel like because I've always been used to working and going to school, I wish I probably would have stood back from work a little bit more to focus on school when I could, but I made it and I had a good GPA. But I think that would have been a good foundational thing for me to do as well. But we gotta work to eat, you know. Y'all know that. Study hard. Don't be lazy in NP school, because lazy nurse practitioner students make lazy nurse practitioners. And the percentage of nurse practitioners that are lazy is probably less than 1%, because obviously we all went back to school to be an NP. You're probably not that lazy, but I do know some. And I will tell you that if you were lazy in school, you're not going to be able to practice effectively. So just make sure you're like really getting into it, really learning your patient population, really learning the systems, the pathophysiology, the pharmacology, the things that you are interested in. Like me, I was interested in cardio, meaning I needed to be heavy on my cardio anatomy and physiology, as well as my pharmacology, pathophys. And there's things today I still have to go and look up. And another thing I always tell people is don't feel like you know everything, and don't be afraid to tell your patient, hey, yeah, you asked that question, I'm asking that question too. I don't know the answer right now, but I'm going to look it up. 9 times out of 10, they're going to respect you a lot more for saying it that way, or saying that you're going to find somebody who knows the answer, rather than you forging an answer, telling them the wrong information, etc. So these are just like little things that are coming. I feel like I'm going to do a good video kind of on tips to those who are in NP school or want to be NPs, but I'm only 5 months in, y'all, so I'm just trying to, you know, trying to take it all in. So that's where we stand. So I'm just kind of scrolling through just to make sure I didn't forget anything. I think I kind of pretty much covered all these questions. A lot of them were repeat questions. Like, a lot of people asked about my specialty. A lot of people asked me about adjusting to the 9 to 5. A lot of people asked me about the transition from RN to NP. What are the role differences between NP and RN? Talk about transition process. Talk about, somebody said my struggles and my strengths. So, RN and NP, I kind of think I already explained a little bit before. You have a little bit more authority. You're now a provider. So versus like back in the day when I'd be like, okay, do I give this blood pressure medicine or not? Let me call the provider and check it out. Now I am the provider that says give that or hold it. And now when I put in orders, it's so weird, y'all. It's so weird. Stuff I used to like ask, even like, I know typically we don't take verbal orders, but stuff I used to easily ask a doctor, like, oh, can I give this to the patient? Yeah. Easily will put that in, put that doctor name in and call it a day and put my little note, spoke to Dr. So-and-so, orders placed, verified, blah, 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 etc. Now when you're the actual person ordering it, guys, it's so crazy. Like, it's so crazy, the emotions and the things you go through, even for simple stuff. Like, I'll never forget, I think I was ordering something so simple, and I'll never forget one day the little hepatic like alert popped up, like, check the liver function, check this, and I'm going through all this, and my friend's like, what are you doing, Shay? I said, it said to check the liver function. And she's like, you know, we give that all the time on the floor, you don't really have to check that, they're in the hospital. And I'm like, but I have to look at it because it's telling me. So it's just like kind of things like that. It's just a very big learning curve. Not gonna lie to you guys. Do I struggle? Yes. Am I new? Yes. Do I need to give myself some grace? Yes, because I'm very hard on myself. I've always been that way, even when I became a nurse. But you're entering a whole different ball game. I know nurse practitioner and registered nurse both have nurse in it, but you're entering a whole different ball game. The learning curve is tremendous. The priorities are tremendous. The way you deal with certain patient like treatments is tremendous. But I will tell you, you will get the hang of it. It's going to take a while. I see myself now doing things that I know I wouldn't have been able to do 6 months ago, but we're doing it. And I'm trying not to beat around the bush with this question, but it's just very hard. It's so abstract to explain. And I think that's why it took me so long to sit here and get on camera with you guys, because I wanted to make sure I was in enough to provide you with beneficial information, but still have that piece where you guys could see the transition. And it's still occurring. I think the biggest thing, though, the differences is the way when you were the nurse, you were carrying out the treatment plan. You were carrying out the interventions. As the nurse practitioner, I am setting the plan, setting the treatment goal, setting the interventions. Like, it's a whole different mechanism. And the task orientation is a lot less. Like, the stuff like putting in the Foley's, putting in the IVs, doing the blood work, all that stuff, that I miss that stuff. I do. But I have a whole many other responsibilities that I have to focus on that compensate, if not overlap, that stuff. So it's like making sure patients are arranged for their outpatient appointments, making sure they're on this med, making sure they're on that med, making sure they're having labs for this, making sure we're following up with this. It's just like, it's very, very different. So it is something I enjoy. It's something I love. It's not anything I regret, but I'm still learning, and I'm going to take you guys on that journey with me. Alright guys, so I am going to close up today's video. I hope it was beneficial for you guys. If you were able to stay to the end, drop a red heart, and if you have emojis, drop a real red heart, not like drop the cardio heart, okay? But thank you guys for tuning in. Thank you guys for getting up to date with me. I hope this Q&A was beneficial and also was able to update you guys on my current transition and how life has changed for me. I am looking forward to doing videos routines and kind of day in the life of a nurse practitioner type things, but I just kind of want to get myself a little bit more settled with my own routine before I share it, because I'm still kind of trying to figure out what my own routine is. So I'll be doing a little bit of vlogging. I'll be doing a little bit of update videos. I will be keeping you guys updated. I know someone also asked me, is there going to be a big shift in my channel? And I think that was one of the Q&A questions. I'm sorry, I skipped it. But there is going to be a transition in my channel just with me going from student to professional. But I was a professional before. But it'll just be a lot more content focused on the transition of RN to APN. So I feel like it's still going to have nursing content. I'm not going to pull completely back away from beauty and lifestyle, but that stuff might not be as big on my channel currently because I'm not really dabbling into a lot of beauty and lifestyle as I talk with the millions of lipsticks behind me. But needless to say, it is going to be a journey, and I'm going to definitely be back on here and trying to be more consistent and even giving you guys hopefully some short content on TikTok and Instagram. I love YouTube to death, but I know that's where a lot of people want to go click and see how things are doing. So I'm going to try it and I'm going to see how we do. But thank you guys so much for tuning in. I hope you liked the video. If you're not already subscribed, make sure you hit the red button so you can stay up to date when I post new videos. Make sure you give this video a thumbs up, and I will see you guys in my next video.